Afternoon and welcome to today's community briefing on our pandemic response efforts. Here once again to provide interpretation is Margie Prop. Thank you so much, Margie. And thanks to all of you for joining us to learn about the latest local developments. Throughout the pandemic, our local health department team has taken thoughtful, measured steps based on data to prevent the spread of the virus in our community. Steps that have prevented illness, protected our healthcare system, and saved lives. And this strategy has consistently positioned Lancaster County as a leader in the state, both in our preventive efforts and in our success with getting a large portion of our residents vaccinated. This chart shows the percentage of the population in Lancaster County that has initiated vaccination by age group. You can see that all age groups, ages 25 and older, have exceeded the 50% mark for vaccine initiation. This is a tremendous community accomplishment. And as of today, 67% of our Lincoln and Lancaster County residents age 16 and older have initiated vaccination. And just over 142,000 individuals, or about 58% of our population age 16 and older, are fully vaccinated. We continue to see demand for COVID-19 vaccine in Lancaster County, and that demand is important. And it's important because the more people we vaccinate, the more we diminish the risk that COVID-19 and its variants pose to our residents, reduce the potential stress on our healthcare system, and make meaningful progress toward ending the pandemic. More progress came this past week in the form of a major national announcement. Last Wednesday, the Centers for Disease Control and Prevention, or CDC, approved expanding Pfizer vaccine eligibility to include children ages 12 through 15. Our health department team was ready and immediately opened appointment times to provide vaccination opportunities to this age group. In fact, my 12-year-old daughter was among those who received her first vaccine at a health department clinic sponsored by the Black clergy of Lincoln last Wednesday evening. In less than a week's time, our health team and community partners have already administered the first dose of vaccine to more than 1,700 of our young people in this 12 to 15-year-old age group. We are so encouraged by these latest developments and the positive changes that we are witnessing in our local conditions. The people of Lincoln and Lancaster County have demonstrated great resilience and a deep commitment to protecting one another through vaccination and preventative action. And because of this, we are able today to reach an historic moment in our community's pandemic story. The announcements that Health Director Pat Lopez will make in a few moments are exciting and would not be possible without the actions of our experienced health department team, our tireless medical professionals, our committed community partners, and of course, our caring residents. And with that, we'll now turn over the briefing to Director Lopez for the latest on our community's progress.
Thank you, Mayor. I join you in being pleased and proud of the real progress we've made as a community. I'm going to start today with our COVID-19 risk dial. Throughout the pandemic, we have based our decisions on the risk dial on several weeks of local data. Our dial metrics are not directly tied to the directive health measure, but the metrics inform our health department's team in decision-making and community education efforts. Here's the summary of our current situation. The 7-day average of new weekly cases shows the significant drop in new cases in just the past 2 weeks. For the week ending May 15th, we had 78 new cases. It's the first time the number of new weekly cases has dropped below 100 since the week ending June 26th of 2020. Our case rate is now just under 4 cases per day per 100,000 residents. This is the lowest rate since last June, and it is well below the case rate of 10 per 100,000 that we have been striving to reach. Over the past 2 weeks, the positivity rate dropped below 5%, a threshold recognized nationally as an indicator that the spread of the virus is under control with adequate testing. For the week ending May 15th, the rate dropped to 2.7%. The average turnaround time for COVID-19 testing has been within 36 hours for nearly 4 months now and has often been within 24 hours. With fewer positive cases, contact tracing has been fast and efficient. We have plenty of capacity to follow up on new cases. The 7-day rolling average of COVID-19 patients in our local hospitals has been around 30 for several weeks. And that represents about 6 to 7% of our local hospitals' medical surgical beds that have been occupied by COVID-19 patients. This means that our hospital systems are not highly stressed by the number of COVID-19 patients and that high-quality care can be provided to each patient. We have fortunately seen COVID-19 deaths drop dramatically since February. This is really a testament to our community response in following guidance and getting vaccinated. 67% of our residents aged 16 and older have initiated vaccination, with about 58% fully vaccinated. This summary of our current situation paints a much improved picture for Lincoln and Lancaster County, and that picture for the first time includes the color green. Achieving the green level on the risk dial is a major milestone for our entire community. Most of our key metrics have now moved into green. That includes case rate, positivity rate, average testing turnaround time, contact tracing, and deaths. Only 2 dial metrics remain in yellow: healthcare capacity and vaccination rate. And the vaccination rate continues to go up as our community continues to respond to the call to be vaccinated. And finally, for the first time, you can see that the risk dial in green is represented by the blue square outlined in red on the color-coded map. The green level on the risk dial signifies a minimal and controlled level of COVID-19 in Lancaster County, meaning our transmission is low. At this level, people in the community may resume a more normal life. We have continued to see variant cases in our community, but they are not having a major impact at this time. Overall, we've been winning the race between infections and injections. This chart is a great demonstration of that. You can see that as the percent of people fully vaccinated has gone up, represented by the green line, the cases per week have gone down, represented by the purple line. While we can't predict the future, we do know that more people who are vaccinated, there is less opportunity that the virus and its variants will have to spread in our community. And with the Pfizer vaccine now being given to 12 to 15-year-olds, we will be able to vaccinate even more of our local community members. Our directed health measure is scheduled to expire on Friday, May 21st. And because of our data-driven approach and cooperation of our residents, we have reached the point where adjusting the DHM again is warranted based on our local situation. Here is a summary of the key changes that go into effect beginning at 12:01 a.m. Friday, May 21st. All indoor and outdoor spaces will be open to 100% of capacity. Plans for large outdoor events will no longer be required. Events at indoor venues with a capacity of more than 500 people will still require approval and a plan review from the health department. In addition, I'm pleased to announce the mask requirement is being removed. This is good news for our community, but we need to remember, however, masks will still continue to be recommended for unvaccinated residents. For example, we recommend that unvaccinated employees of restaurants, bars, and other food establishments who have direct contact with the public should continue to wear a face covering. Any child care provider that's not fully vaccinated should wear a face covering. We also encourage employees of barbershops, hair salons, body art facilities, cosmetologists, and estheticians, as well as massage therapists, to wear masks when working with clients, even if they're fully vaccinated, due to the close contact. Healthcare settings, congregate living settings, and schools should continue to follow specific CDC guidance on masks. CDC guidance is strongly recommending that schools continue to follow their guidance for all students to be masked and 3 feet apart. Fully vaccinated people must wear masks when required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local businesses and workplace policies. Some businesses and institutions may still require masks as well. We also know that people may have different comfort levels when it comes to removing their masks. Parents of children under age 12, for instance, may choose to continue to wear masks. It is important for us to be aware of these differing comfort levels and to be understanding. If you are fully vaccinated and want to continue to wear a mask in public places, we really encourage you to do so. As I mentioned, businesses have the flexibility to continue to require masks. To explain more about how the new DHM affects local businesses is City Attorney Johansi Christie.
Good afternoon. Thank you, Mayor, Pat. It's nice to be up here and have the opportunity to talk about some good news. As Director Lopez pointed out, going forward, it is important to understand that businesses, as always, have the right to impose their own restrictions. This includes requiring their patrons or employees to wear face coverings. If someone does not comply with these restrictions, they could be denied service or they could be asked to leave the business. Someone is asked to leave the business and they refuse, there could be other criminal charges, penalties, such as trespass, as an example. With that said, I would like to take a moment just to thank the dedicated city employees at the health department and all the other city employees that have worked so hard for us to get here. I also want to take a moment just to thank the community. Not only have we seen a great response with vaccinations, we've also seen a great response in the community, including the business community, with everyone trying to come together and do what's best for the entire community. While I recognize that we still have much needed progress ahead of us, I'm very pleased with where we're at today, and I look forward to the future. So, thank you, Director Lopez.
Thank you, Mr. Christie. Well, also today, we want to mention the Lancaster County Medical Society. The Lancaster County Medical Society and its members have been valued partners, and we've been working closely with them throughout the pandemic. And joining us here today by Zoom is Dr. Eric Avery. He is the president of the Lancaster County Medical Society, and he'll provide additional perspective on the progress we're seeing in our community. Dr. Avery?
Thank you, Director Lopez, and thank you, Mayor. On behalf of the physicians and providers of the medical community, including One Health Nebraska, CHI, Bryan, LSH, and all of the different medical providers throughout the community, we would really like to extend our appreciation for the continued collaboration with Lincoln Lancaster County Health Department. The community support, each other's willingness to protect our neighbors, the mask implementation that we had early on in comparison to many other communities have really saved a number of lives that we just can't count. It's tremendously been helpful for our community. And quite frankly, back in October and November, it was really, really scary. It was getting really bad. And with the community effort, with our local representatives, with everybody pitching in and doing the right thing, it has tremendously helped. And we would all like to extend our deepest gratitude for everything that you guys have done. I do want to reiterate also that many offices and businesses may still require to wear masks. And I really, I definitely agree with that. And I think a lot of people that we work with every day actually say that they're going to continue to wear masks, and we need to be comfortable with people wearing masks. That might be something new that goes on for a long time. But most importantly, continue to make smart decisions, wash your hands, and if you haven't done so already, get vaccinated. If you have any questions about the vaccine or concerns, talk to your physician, talk to your primary care provider, talk to whoever it is. It's extremely important. It's very safe. We have a ways to go still to get a lot more people vaccinated, but you've done a great job, and we really appreciate it. Thank you so much.
Thank you, Dr. Avery. We appreciate the continued support and assistance from the Society and all the members. This past year has shown us that this virus can be unpredictable. If our local situation changes, we will reevaluate the current recommendations and the directed health measure and make adjustments. But we do know that having more people vaccinated will continue to result in fewer cases and to lessen the impact of the variants. If you're not yet vaccinated, as Dr. Avery said, we urge you to sign up and schedule an appointment at covid19.lincoln.ne.gov or just by calling 402-441-8006. You can also find a local pharmacy offering vaccinations at vaccines.gov. As the mayor said, we're ready to begin vaccinating 12 through 15-year-olds. We were ready as soon as the CDC approved expanding Pfizer vaccine eligibility. We started vaccinating children in that age group at the neighborhood clinic held at City Impact with the Black clergy. We then had hundreds of young people come to the clinics at Pinnacle Bank Arena on Friday and Saturday, and many more received the vaccine at the neighborhood clinic at Cristo Rey Church, where we partnered with El Centro this past Sunday. There are an estimated 16,285 children in that 12 through 15 age group, and more than 1,700 have been vaccinated in less than a week. We've already reached 10% of these young people in our community. We are very pleased with the level of interest we've seen from parents in getting their children vaccinated and expect to see that number continue to increase this week. Here's a quick rundown of our upcoming clinics. We have a neighborhood clinic at the F Street Community Center from 4 to 6:30 p.m. today, and walk-ins are welcome. There is also a drive-through clinic at Gateway Mall until 6 tonight. Appointments are preferred, but people can drive up as well. On Wednesday and Saturday, there are second dose drive-through clinics at Gateway Mall by appointment only. On Thursday, we will be at the arena again, and on Friday, we will be offering vaccinations at the health department. We are also hosting neighborhood clinics in other areas of Lancaster County. On Monday, May 24th, we will be in Waverly, and on Thursday, June 3rd, we will be hosting a clinic in Hickman. Vaccination has played such an important role in getting us to where we are today, but it's not over yet. Together, we have achieved a major milestone, and now that we are at green on our COVID-19 risk dial, we want to stay there. If you're not yet vaccinated, please do so as soon as possible. If you have questions about the vaccine, as Dr. Avery said, talk to your doctor. You can talk to your pharmacist or other individuals that are knowledgeable about the vaccine. Remember, the vaccine not only protects you, it also protects your family, friends, and loved ones. And with that, we'd be happy to take any questions.
Hi, Director. This is Brent with Channel 8. You touched on all the numbers earlier, and we know that they've been improving for a while, but how much did the CDC's guidance that came out impact this decision to remove the mask mandate? And was that sort of the final straw?
No, just being really honest, Brent, the CDC mandate really had nothing to do with our decision. We were already in the process of moving towards that. We were just waiting for some final numbers. And even the CDC changes, still many people don't realize that they indicated people still need to follow state local regulations that are already in place, and several other states have varying measures in place. So the CDC guidance really didn't have any impact on where we were going as a community.
Kind of going off that, there was a lot of confusion, I know, in some places that had the local mandates following the CDC guidance. Was that a consideration that you didn't want there to be this confusion and this issue of determining, and I guess, how do you determine if someone's been vaccinated and whether or not they should be wearing a mask when they enter a business?
I'm not sure exactly what you're asking. Can you say that again?
Confusion. I know we talked to some local businesses about, if the mandate here was to change to reflect that to where non-vaccinated people would need to still wear a mask, how do you figure out if someone's been vaccinated or not when they come into your restaurant or business? Was trying to avoid that kind of confusion, was that a factor in the decision at all?
No, we're encouraging local businesses. They can still require people to come in and wear a mask when they're when people are coming in to them, receive services, and whether they're vaccinated or not, they can still require that. We really weren't considering the way CDC had framed it, and I know it did create a lot of confusion, but the bottom line is that fully vaccinated people don't really have to wear a mask, and if you're not fully vaccinated for whatever reason, then it's recommended that you wear a mask. And I think the CDC chief has said they expect people to be honest and follow that guidance.
Director Lopez, Mark at KLIN. With about 29,000 recovered, do you consider those in your immunization totals, not just the vaccination totals, as you go towards your 75% vaccination level? Is there a correlation between those that would have some level of immunity from having recovered? And does that figure into your calculations at all?
You know, Mark, we haven't calculated those in, and we'd have to go back. You know, there's still question about how long people have immunity. I know in some areas of the country they have looked at that, but if we went back, we would just go back probably the number of cases we've had in the last 3 months. So no, we haven't counted that, because we do know that even if you've had COVID, it's still different than receiving the vaccine, and the vaccine provides the greatest protection. We've actually dealt with some situations where people have had COVID once and then have had it again in 5 months' time. So that's why we've really promoted strongly getting the vaccine.
Hi, Pat. Matt Olberding with the Journal-Star.
Hi, Matt.
Hi. Can you clarify for me when exactly the mask mandate ends? Is it 11:59 Friday night, or is it actually like 12 a.m. Friday morning?
It goes into, the new mandate goes, directed health measure goes into effect at 12:01 May 21st, Friday morning.
Okay, so basically masks won't be required starting Friday.
Right. Fully. You know, we've removed the mask, and people that are fully vaccinated, those who aren't fully vaccinated should continue to wear a mask, but that's not in the directed health measure. It's in the recommendations.
Gotcha. Okay. And then I had one more question. The 3 women who died last week, I think you told the council yesterday that none of them had been vaccinated. Do you happen to know if those were people who just chose not to get vaccinated, or for one reason or another hadn't had access to the vaccine yet?
We're not really sure on that, Matt, and we're continuing to research that to see why they weren't vaccinated. Because if you remember, even for homebound individuals, we vaccinated over 850 individuals in their home. And we had done a lot of extensive work through physicians and other providers and home health and private agencies and that to locate people. So we have to think maybe there was some measure of not wanting to get vaccinated, perhaps.
Okay, thank you.
This is Brent with Channel 8 again. You did mention the possibility that the mandate could be reinstituted if things change. You know, at what point, I guess, would that kind of be a consideration again? And with the way things are trending now, do you anticipate that happening?
You know, Brent, I don't anticipate it happening. You know, I think our community's shown all along their commitment to doing what we need to do to move forward. And it's actually, as Dr. Avery said, prevented many deaths and other cases that we could have had. But we don't know what's going to happen for sure in the future, and we don't know what other variants might come. That's why getting the vaccination is so critical. That's what stops variants. But if our positivity rate starts going up again, and if our hospitalizations start increasing and get to a level, start reaching a level where we were in last November, late October, and if our case numbers start increasing, those are all things, not just one thing. We're going to look at all those same metrics as we've done all along. And that would mean that we would have to have a change. But we will keep the community aware of how things are progressing and be sharing information. But I just look at Lincoln and is really going in the right direction. It was so frustrating to hang at those same level of cases when we had so many people getting vaccinated and positivity rate and that. And then finally, you know, you can see the great turnaround that we've been seeing. And actually, you know, for the last few weeks, this wasn't something we just decided in the last few days. We've been following what we've told you all along, that we look at data over 3 weeks at a time. We look at all those other measures. We've consulted, reviewed nationally what's happening, because we don't want to go backwards, but we want to go forward. And I feel really compelled to the community. We told them what it was going to take to get us in green and what it was going to take to remove the mask mandate. And I want to honor that. And that's where we are due to the community's hard work.
This is Bill with 1011. You know, just 78 cases last week. We've been in the single digits this week. Do you attribute that solely to those vaccination rates? I mean, case rates have really, fallen off a cliff in May.
But you know, Bill, when you look at that other chart we showed at the end, you can see that direct correlation as the numbers have gone up, as our vaccinations numbers have gone up, our case numbers have just gone down dramatically. But it took us a while to get off that cliff we were on to finally get there. I think Sunday we had 3 cases, or Saturday, then we had 4 Sunday, and then we had 5 yesterday and 6 today. And, you know, to be honest, at first we're like, I hope there's not something wrong with the data mart, you know, and we keep looking at it, but it's, now when I see 6 cases, I'm absolutely thrilled. Back last March and April when I saw 6 cases, I was really worried about what was to come. So I expect good things.
One more question. It's kind of data related. I'm looking at the dashboard right now, and it still uses percentage of population 16 plus vaccinated. Is it the plan to change that to 12 plus and use the data based on that population?
Yes, it is. And we're in the process of making sure how we do that so that it will be a representative picture of what's really happening. But we're actually looking at the population number. There's been some back and forth about what the actual number is that we should be using, but we do expect to change that in the very near future here.
Thank you, Pat.
Thank you, Director Lopez, and everyone at the health team. And thank you to Mr. Christie. Thank you to Dr. Avery and the Lancaster County Medical Society. All of you represent such important parts of the team that has helped us reach this milestone in our ongoing pandemic response efforts. And I say ongoing because even as we celebrate our community's arrival into green on the risk dial, we still know that we have work to do together to advance the health and security of our community. Our ongoing efforts will continue to include the efficient and equitable distribution of vaccines, as well as the publication of information and education about steps we all can take to protect ourselves, our loved ones, and our neighbors until the pandemic comes to an end. What our ongoing efforts will no longer include, at least for now, are these weekly televised COVID-19 briefings. We began these regular updates back on March 6, 2020, 2 weeks before our first local case of COVID-19 was reported. And by our count, today marks the 122nd COVID-19 briefing that we've held since then. Over the past 14 months, we've provided you with the most accurate and timely information available on our local conditions. And please know that we remain committed to providing you with the information you need to keep yourselves and your families safe. The health team will continue to update the data dashboard and the risk dial. We will continue to provide written updates every weekday, and we will continue to post the most current information on our website, covid19.lincoln.ne.gov. And of course, we will schedule televised briefings as needed. I want to thank everyone at City Communications, who were just cheering a minute ago when I mentioned that this is coming to an end, for their incredible service to our community in making these briefings come to life, and so often. I also want to thank Melissa. The briefing's value comes from our community members' ability to access the information presented in them. And as such, I want to thank our local news media. Thank you to each and every reporter who has participated in these briefings. Thank you for asking important questions and playing such a crucial role in keeping our residents informed. And I want to assure the press that we will continue to work with you to provide accurate and timely answers to the questions that you and the public will continue to have as we move forward. And finally, I offer thanks to the people of Lincoln and Lancaster County. We see the proof of your ongoing commitment to protecting the health and safety of our community at every turn. We see your commitment, your strength, and your resilience in the numbers that Director Lopez shared today. We see the tremendous lengths our healthcare professionals have gone to in order to provide care and healing. We see all of our educators and parents have done to enable our schools and universities to be open to our children all year and to allow for our graduates to walk across their stages this month. We see the innovative and important steps our businesses have taken to protect their customers and employees, and we see all of you who have made the commitment to support our businesses by shopping local. We see the countless helpers who have spotted the gaps and then filled them. Helpers like the 110 members of our sewing community, many of them in Lincoln's quilting guilds, who over the past year have created and donated 34,134 face masks, 585 surgical scrub caps, 269 hospital gowns, and 12 pairs of surgical shoe covers to over 75 nonprofit organizations in our community. And as if she didn't have her hands full enough with these briefings, our interpreter, Margie Prop, is one of those in the sewing community who has donated her time creating masks. We're so grateful to you, Margie. Thank you. And I thank our community because today's successes are ones we have forged together. We now understand in ways that we never fully could have before what a powerful contribution our individual actions make to our collective well-being. This pandemic has exposed our vulnerabilities, but it has also revealed our community's strength and resilience when we face adversity together. As we continue to move forward into a future that looks brighter each day, our masks may fall by the wayside, but let's not cast aside our care and compassion for one another. Let's continue to offer each other the strength, the support, the grace, and the kindness that has seen us through to this moment. Thank you.